How many people are currently doing threads? So everybody's pretty much new to it? Great, okay. We structured the course a little bit differently. That being said, maybe 80-85% of what comes into your office is going to be mid-face, lower third, and neck. And if you can learn to do mid-face, lower third, and neck, you're going to make this course money back. You're going to make your thread order back. Because depending on your demographic, people are getting $1,500, $2,000 for that work. You're getting near surgical corrections, which we'll talk about. And it's only about 30 minutes work. So the profit margin on PDO thread lifting is so much better than filler. We'll talk about where it fits in, but just a little bit, how many people are relatively new to aesthetics? Good, okay. An interesting trend. The first 2 years I trained, everybody in the room was plastic surgeons and dermatologists. In the last year, it's been internists, pediatricians, ER docs, a lot of RNs, NPs, PAs taking the course. But we had to restructure it a little bit because a lot of guys, anesthesiologists, a lot of guys like anesthesia, like rheumatology, are used to sticking needles in people. A lot of general internists are not. Pediatricians may not be. And also, I was getting feedback that said, I'm really good at, I can put in the needles, I put in the thread, felt comfortable with that, but I don't come from a background of aesthetics. I don't know how to evaluate a face. I don't know what I'm looking for. So we restructured it to give a little bit of the basis of a facial evaluation, facial analysis, without getting it, making it a fetish, but just a foundational to try to give everybody the common language. We're going to talk about the introduction to threads, basic facial assessment, choosing proper threads, combinations of threads, anesthesia, areas of treatment, aftercare instructions, complications, and we'll talk a little bit about pricing and fee structure. Basic facial assessment. While there are certain racial and cultural variations, ideas of beauty, there are certain universal standards. One of those is symmetry. If somebody, no matter what culture you're in, if one eye is here and one eye is here, it looks different. And people react to that. Sometimes very vigorously react to people who look different. And by different, I mean a lack of symmetry. And we as practitioners and aesthetics have to be aware when we look at someone of what is asymmetrical. If something doesn't look right, what is it? A lot of times when you look at I'm from Los Angeles. When I look at somebody and they look weird, frequently they've had too much work done. Or the work, when I say the last thing I want anybody that I've worked on to do is leave and have someone say, hey, who did your work? Who did your face? Last thing in the world you want to hear. You want it to be natural. You want it to people look refreshed, look like you're on vacation, look like you slept well, something of that nature. You don't want to be overlooked. That creates the eye, draws the eye to it. The rule of thirds. The upper face, mid face, and lower face have a certain symmetry to them. If somebody has a receding chin or a protruding chin, there's nothing wrong with that. That's genetic, but it's asymmetrical and our eye is drawn to it. That's all I'm saying is the eye is drawn to things that are asymmetric, both in the AP plane and also in the sagittal plane. The face in profile is a series of convexities, concavities, and if one of those stands out, if you've got this huge forehead and receding chin, that's why people get chin implants. They're trying to reduce, and what we're trying to do is recognize where there's asymmetry and minimize it a little bit. We're not doing surgical procedure, but we're looking at how can we balance the face. This is really apparent in lips. Lips have a proportion that looks pleasing. When we're young, the lips are very thick, very full, very pouting. As women age, as their estrogen declines, and estrogen is tied up with hormones, with skin, collagen breaks down, they lose volume, and the upper lip particularly gets thin and it loses the cupid bow. That's a marker of age. When we look at a face, What is it that makes us look old? When we're young, our faces are heart-shaped. We have these big apple cheeks, and I'm speaking in generalities, but youthful face has a V shape. As we age, say in the late 20s, early 30s, the malar fat pad starts to descend with gravity, exposing the hollows under the eyes, creating the smile lines, and eventually creating the marionette lines. It's just all descent. Weakens the jawline, weakens the neck. Marker of age. That's all. When you look at somebody, we make judgments about how old someone is based on these unconscious markers we're looking at. Weak jawline is a marker of age. Poor skin quality, sunspots. I also don't teach this course as a one-off, as PDO thread. We emphasize it. But most of you are in aesthetic centers or are doing a full service aesthetics. I try to approach it as combined therapy, because there are things that you can do instead of PDO threads, we'll go over that, and there are things that nothing else will do other than surgery that you can do with PDO threads. But when we look at aesthetics, when we look at beauty, we're really talking about the 3 Ds of aging. Deterioration, and by that I mean cellular deterioration, breakdown of collagen, deflation, volume loss, and descent, ptosis. Those are the 3 markers. That's what we address. We talked about the changing facial shape. As we late 20s, early 30s, this starts to happen. Rather than being heart-shaped, the face is now rectangular. When you look at people's photos from when they were young, when they were about 30, and when they're 50, the face goes from being heart-shaped to being rectangular with, rather than protruding cheeks, now things become flat. And as they get a little older, the face becomes gourd-shaped. This is the problem, because most of the people who come in for aesthetic work are going to be between 30 and 60. So they're starting to get this gourd shape. Up until now, the only thing we had to offer was filler. Now, what happens when I'm saying that gourd shape, when you look at it, it's a marker of age. People, it's the inverted heart shape. So when you add filler, you're filling in the lines. The eye is also drawn to straight lines. That's why when it's shadows that we're looking at. We're drawn to the shadows under the eye, the hollows. We're drawn to horizontal lines across the forehead. We're drawn to the smile lines. The eye is drawn to these things, and we make assessments about someone's age based on these how they cast these shadows. When you use filler, you can get rid of the shadows, but you're adding volume. You're adding mass. We see that especially in the upper lip, vertical lip lines. Add filler and they end up with chimp lip, because you're adding volume, but to get rid of the shadows. These are things that PDO threads, by lifting, will help. So for deterioration, deep furrows, crow's feet, vertical lip lines, crepey skin around the mouth, these are all markers of age as well. Loss of bony prominences, zygomatic arches flatten, descent in the malar fat pad, the jawline weakens. Again, these are all our markers. When we look at someone's face, these are the things that draw our eye. This is just giving a vocabulary to what we're going to be doing today. How do we address these things? Cellular deterioration, let me step back for a second. I make a distinction between cosmetic and regenerative aesthetics. What we're doing here is regenerative aesthetics. Regenerative, things that are regenerative don't do the work. It's not like putting makeup on. What they do is they stimulate your body's own immune system to create the desired effect. So within that is PRP, stem cell, growth factors. Sculptura is an example of a regenerative procedure. For those of you who are not familiar with Sculptura, you put it in, it puffs you up, it's for volume loss. So it works on number 2, on deflation, and 24, 48 hours, it's gone. And over the next 4 to 6 months, it acts as a scaffold and your body's own collagen deposits on it and does the work. That's definition regenerative. PDO threads are in that class. PDO threads, and now they've come up with PLLA threads, polyl-lactic acid, which is solid sculpture. We'll talk about that a little later, but PDO threads are surgical suture. They're used in cardiothoracic surgery, completely safe. But when they break down, they stimulate the body's immune system to produce collagen. So for deterioration, so we're talking about today is regenerative aesthetics. We're not talking really about cosmetics, although the effect may be considered a cosmetic. I don't particularly like that term. So what do we do? For deterioration, we can do microneedling with PRP. They have VistaPen, which is a really good microneedling device. You can do laser, you can do dermabrasion, things that affect the tone and the texture of the skin itself. For deflation, volume loss, we can use dermal fillers and volumizers, biogel filler, which we're going to talk about today, fat transfer. For descent, this is where PDO threads. Prior to the use of PDO threads, there was nothing anybody could do for that sagging jowl. You can fill the marionette lines, but you can't lift them and hold them. That was the exclusive purview of the plastic surgeon. What's happened over the last 20 years, maybe longer, it started late 90s, I guess, people decide they don't want surgery, they want alternatives. And the marketplace has answered. Back then, the only lasers around were CO2. Were fully ablative lasers. That if you wanted a laser, that's what you got. Now, people don't want CO2 anymore. I mean, if they can afford the 7 to 10 days off work, yes, but most people don't. Most people will choose a non-ablative laser. So the trend has been, if you talk to plastic surgeons, they'll talk to you about the heyday of plastic surgery, and they're still not hurting. They're still doing a lot of breasts and a lot of boobs and a lot of nose jobs, but a lot of their non-surgical work, the stuff they used to do, the little lift, now it's being done by fillers, it's being done by threads, it's being done by high-intensity focused ultrasound, Althera, it's being done by radio frequency. So there's a lot of technology that that are responding to people's desire to not have surgery. And this is not just aesthetics. Those of you who are in surgical fields know that. People are looking, what is my alternative to heart surgery? What is my alternative to any kind of surgery? Can I do this in physical therapy instead of surgery? Can you give me some injection instead? People want, and not only do they want non-surgical, they want natural. People they have high blood pressure, they want, what kind of herbs can I take? So maybe this is an American cultural. I don't really have the perspective on world cultures, but in America, these are the forces that have been pushing towards this moment where PDO threads are a good answer because people don't want surgery and people want natural. Well, that's what these products are. They're regenerative, and they'll give you some people call it mini facelift, and literally it is lifting and holding. But there's no other competitor for that. Regenerative aesthetics, these are just things that I consider part of that trend. Let's talk a little bit about the science behind PDO threads, and we talked about cosmetic versus regenerative. These are the physiological effects. I'm not going to spend any more time on it other than this is a group of healthcare professionals, so you should know that there is science behind these threads. There are studies, there are journal articles around the world written as thread. Most of the threads come out of Korea. A lot of the research comes from Asia. But a lot of American plastic surgeons and dermatologists are now doing studies on these, and this is what they found. The important thing is number 3. Now, it is a foreign body reaction that makes the threads work. However, so is a splinter. PDO threads work by stimulating fibroblasts. Fibroblasts elaborate 2 things. They elaborate collagen and elastin. So you're going to get a little bit of volume, but you're also going to get tightening. You're going to get tightening of that crepey skin. This is where the monos come in, but they don't work immediately. This is another American cultural thing. My office for 3 years was in Koreatown. 90% of the people I worked on were Asian or Fitzpatrick 4, 5s, and 6s. When I got there, they were doing thread lifts, but what they call thread lifts are putting 120 little threads in the face. Now, and that was huge. That's huge in Asia. Here's the difference. You tell an Asian person that I'm going to put these in threads in your face, and in 4 to 6 weeks, you're going to look wonderful. And they go, okay. You tell that to an American, and they say, what are you talking about? I got an event tonight. I'm not waiting 4 to 6 weeks. I'm not paying you now and waiting 4 to 6 weeks to see whether this works. It's our nature. Instant gratification is not quick enough. So the interaction between the barbed threads and the smooth threads, we're going to go over. The smooth threads are wonderful. They're putting the mesh in. It's going to build the collagen base. It is real medicine. The skin, the integumentary system is the largest organ system in the body. It lives, it breathes, it goes through its own lifestyle. So it's physiological effect. It's not a cosmetic effect. 4 stages of healing. They're overlapping. We utilize this. Hemostasis, we're going to see today. The bleeding, some people bleed longer than others, but unless they have a serious problem, which hopefully you screen for, it goes away. It stops in just a couple minutes. Inflammatory phase lasts about 48 to 72 hours. Anybody who's ever been in a car accident knows that day 3 is the worst. It's your body's reaction to trauma. It's a recovery period. And it builds up to about 48, 72 hours, and then it grows. So these are overlapping curves. As the inflammatory phase is dying, you're into the proliferative phase. This is where collagen, elastin, starting to be elaborated. It lasts about a month, 4 to 6 weeks, and then you go into the maturation and remodeling phase. This is why when you sell the packages, you're bringing people back every 4 weeks or so. You're getting them at the end of the proliferative phase. It's like putting a layer of paint down, letting it get just about totally dry, and then putting another layer down, and another layer. That's what we're doing, building collagen base. So that's the reason, this slide, the reason why you structure your packages, why you bring people back at 4 to 6 weeks, because you want to get them at the end of the proliferative phase. There's a lot of threads out there, and more of them are pouring onto the market. People are talking about Euro threads and Italian threads. There's no lack of threads. As practitioners, we need to be wary of this because there's 3 parts to doing this. There's manufacturing, there's sales and support, and there's training. I get approached by a lot of these threads to train the people that they're selling the threads to, which means they're selling threads, they've been selling threads without any training. Give you an example of this. I sat down with a guy, a Korean that had his own line of threads, and he showed me one that when we'll show you how the thread is inside the needle, comes out in a little loop, and there's a little sponge holding it. So when you pull the needle out, the sponge comes off, and that end of the thread unfurls, and you leave the thread in. Well, he was showing me proudly this one that didn't have a loop. And I'm thinking, that's awfully strange. Why would you not have the loop? He goes, oh, so you can back out, and if you're wrong, you can. And I said, why would anybody who's properly trained ever need to do that? They do it because they're selling to people without training. So once you're trained, you can choose whatever threads you want, but just be wary. A lot of them, you don't know where they're manufactured. But the point is, with Miracule, and I'm not knocking anybody else, any company's threads, I've used Nova threads, they're good product. Why I like Miracule? Miracule, Dongbang is the parent company. Dongbang is the largest manufacturer of acupuncture needles in the world. That's their forte, needles, not threads, needles. The threads are good, the threads are PDO, but because their manufacturing is the needle, their needle has a larger, this is where they had their place in the marketplace, they're able to have a needle with a larger interior diameter without a proportionally larger needle size. That means less tissue trauma. Means you can have a larger thread. That's how they came up with the Forte, the 18 gauge thread, which is the equivalent of an O surgical suture, while Nova threads had only a 19. Not a big difference until you're starting to try to lift a buttock or trying to lift a heavier part of the body or a thicker person where you really need that 18 gauge. The thinner shell also gives you greater flexibility. This is really what sold me on Miracule. You'll see today that you don't just shove the needles in. The needles are not rigid. They have flexibility to them, and you flex them, and you extend them. You can, if you're too deep, you can flex the needle and drive the tip up. If you're too superficial, you can flex it and drive it down. Without that flexibility, when you hit a cutaneous band, or if someone's had previous surgery or previous work, the needle can bend on you. Now these needles can be $40 each. So you don't really want to be wasting a lot of them. So why I like Miracule, I like the sensitivity that I can have when I'm putting them in, and I like the fact that they don't bend. They flex, but they don't bend to the point that you can't put a bent needle into the skin. This is the basic difference. The smooth threads stimulate neocollagenesis. The barbed threads, neocollagenesis plus lift. You're not going to get much lift with the smooths. You're building the collagen base. That's their job. The barbs lift, and when they break down, yes, they do, but you're not putting in a dense network, meshwork of the barbs, so you're not going to get the same degree. So most of the schematics that we show are going to be the barbs doing the lifting work and then adding monos or smooth threads to where the skin needs it. Perioral area where there's some crepiness, around the eyes, etc. The left side of the body has been lifted, the right side is not. And see, that's the lifting effect of the barbs. Just give you some people have a surgical background or have done surgery during our training. This gives you a rough idea of what we're dealing with. When you're dealing, most of us are going to be putting in like 2190 sutures. We'll go over that, but your workhorse in your practice, another thing I have to caution you, when you look at the price list, I got overwhelmed when I look at it. 2 pages of threads, and how do I have to stock all of these? Do I have to pay? I mean, look at how pricey. No, we'll go over which ones you need to get started. There are probably a half a dozen threads that you could live off of. You can do your entire practice with. And then as you need them, you add others. I needed this sheet to refer back to because, yes, and you were dealing mostly with the 90s and the 60s. That's 3.5 inches, which is about what you're going to use on a face. And why do they come in different lengths? Well, in the face, you're going to see about 3.5 inches gives you your best lift. The 100 millimeters, too long for most faces. 60 mil, you can't put a 90 to do a brow lift. You need a 60 or under the eye. So there's reasons why we do the 90s and the 60s, and that refers to their length. You get the 21, the gauge is the thickness of the thread. The lengths are in millimeters. Now, let's talk a little bit about the threads. Monos are sharp needles, smooth threads. They're monofilament. This slide is to help decode the price list, because there's so many different options, people get confused. So I'm trying to put structure on it. You've got smooth threads, you have enhanced smooth threads, you have barbed threads. That's it. The enhanced smooth threads, we've got screws, which have it wrapped around so they give volume. It's a smooth thread, but it adds a little bit of volume. Great in the lips, nasolabial folds, the 11s. Broom threads like a cat of nine tails. It's a single thread, you pull it out and a bunch of monos spring out. Same with the volume thread. It's multiple monos in one. That's what we call enhanced monos. Instead of making 10 pokes around the eye where you have so much vasculature, put in a couple of broom threads. 2 sticks and you're getting as many monos. So these are options, but I want to eliminate the confusion. There's only really 3 types of threads. That's what a smooth thread looks like. And it'll have a little sponge holding it in place, and when you penetrate the skin, it pushes the sponge back, and when you pull out, that end of the thread is now anchored by your finger. You pull out the needle and the thread is embedded. Oops, so that's one of the schematics. You can use them as a little meshwork around the eyes. Mono threads, you create a meshwork of at least 5 to 10 threads per treatment area. And you place them anyway. You can do it. We'll get to more of this tomorrow, because believe it or not, there are advanced mono techniques. It's not just as simple as putting in threads, but in the beginning, just put them in as a hash mark. You can put them in horizontally, vertically, diagonally. You're creating a mesh that when it melts, it's melting together. This is like putting batter in a fry pan, and as it cooks, it closes up. That's what we're doing. To better address facial contours, you can use longer threads. You can use a 3-inch thread and a 1 inch if you've got area. That's why they come in different lengths. It's for facial contouring, because that's what you're going to do. If somebody's got old acne scars or they have crepiness, you're going to be building areas of the skin that need it. And sometimes you can use the same size. Sometimes you're going to use long ones, short ones, etc. The upper lip, you're cross-hatching 5 to 10 monos per side, just as an example. Crisscross them in different ways. When we talk about the vertical, these do a great job on the upper lip, on smokers. The vertical lines that we talked about are really problematic unless you have a really light touch with Bellatero. You'll end up adding volume to the upper lip and it doesn't look really good. You can do the same with threads, but you're not putting the threads in the wrinkle. They're not filler. You're cross-hatching under the so that when they melt and they tighten, they're under the thread and they're lifting it. So we'll get some experience doing that today. This is, we talked about it, rebuild a depleted collagen base, 3 to 5 sessions of monos, 4 to 6 weeks apart. Monos dissolve in 3 to 4 months. Monos tend to be thinner than the barbed threads. The barbed threads, the thicker barb, they're 21 gauge, and more, sometime will last 6 months. They'll eventually hydrolyze to nothing. They'll be completely gone. We've had cases, plastic surgeons that have had patients who they wanted to have a facelift. The patients wanted to see what it looked like first, so they had a thread lift. Then they decided they wanted to have the plastic surgery, and when the surgeons went in, they found that there was no disruption of the tissue planes. There was no scar tissue. They could even see the end of the thread dissolving. So they recognized that it was a very healthy thing. It didn't destroy the patient's opportunity to have a later surgery. It actually enhanced it by giving the tissue better quality. This is a screw thread. Again, it's smooth, there's no barb. You put it in and it adds a little bit of volume. Where do we use them? We use them in the lip flip, which hopefully we'll get a chance to demonstrate today. That is a moneymaker. You can easily get $500 for a lip flip because it gives the appearance. It's not an augmentation, but it gives visible, makes the upper lip more visible and restores a proportion to the lower lip. Your costs are probably about $14, 2 smooth threads. Smooth threads come in packs of 25. Roughly, it breaks down to about $7 each. Barbed threads come 12 to a pack, and they roughly break down to $40 to $50, depending on the needle type, which we'll go over. So this is into the cost factor, but your end result, you'll be able to charge adequately to make this worth your time and your investment in the materials. Screw thread options, again, confusing, let's simplify it. There are 3 different kinds of screw thread. They're exactly the same thing. They are a screw thread. The regular screw, the double screw is twice the thickness. The super screw is twice that thickness. So I like using either the regular screw or the double in the lip, but I can't use a super screw. Too much resistance, it's too thick. I might use it in a smile line, but be aware the only difference between them is the thickness of the thread. Short ones, again, we're looking at short and long, thick and thin. The short ones you're going to use for the lip flip, which hopefully we're going to demonstrate today. We use them for static vertical lip lines. We use it for glabellar furrows, marionette lines, and the nose lift, which we'll show some photos of yesterday. It does a beautiful work job on lifting the tip of the nose or building a bridge. The long screws, which really I teach in the advanced level, is because the barbed threads are a thick needle. The monos are very, very thin needles, like an acupuncture needle, and it just takes a little bit more skill to be able to get that in the skin without it bending and without it wobbling. This is just the lip flip. We're putting it in. We'll demonstrate it, but this is basically how you would work in a perioral area. You can do the upper lip lines with a cross-hatching of different lengths or thicknesses, and the lips. Barbs have little fish hooks on them. When you're dealing with the barbed threads, they come as a sharp needle or they come as a cannula. In training, we only do cannulas. What is the advantages? A sharp needle, easier to put in. Goes in like butter. It's got a sharp needle. Disadvantages, you can hit a blood vessel, you can shear a nerve, you get more bruising. There's certain procedures that you really can't do with it, like a brow lift, because you got the vasculature up there, you have a real risk of a hematoma filling the upper eyelid. In training, I only use cannulas for two reasons. One, it's safe, and second, if you can put in a cannula, you can certainly put in a sharp needle. So train with it while it's harder, with something harder, and then if you need to. Why would you ever need a sharp needle? You would need a sharp needle in some men. They have very, very thick skin. Even if someone's had previous plastic surgery, they may have scar tissue. You may not be able to penetrate with a cannula. Someone who has really deep pockmarking from acne, they may have enough, you may have problems getting through that. People who've had recent sculptura or radiesse, even though you're putting volumizers in a different plane, not everybody does that well. So there are circumstances where you may need to have them, and at some point you probably should have some in your pack, because I've encountered cases where I could not get in with a cannula. The patient's skin was just too thick, and when I got in, it was the thread was bending, and I don't want to go to a thicker thread than I have to. And the thicker your thread, the thicker the needle, so it's going to make it even harder. You switch to and sometimes in some body treatments. I trained some nurses in an office in West Hollywood. I did their basic preceptorship back in November, and then they were the group that said, now we want upper game, we want to start doing arms and knees. So I went in and trained on how to do that. And we were using both, because now they're experienced, they can use the sharp, and the patients were experiencing, when we were doing knees, less pain with the sharp than with the cannula. Well, when you look at it, I might not be as concerned about putting a sharp needle in the knee as I am along the jawline. I don't have to worry about a facial nerve. I don't have to worry about a mandibular artery. So there are instances where don't discount the sharps as being old technology. They have their place. It's just with cannulas, just like with fillers. Some of you, I assume, does anybody not do fillers? Okay. If you do fillers, you're going to have no problem with PDO threads. Technically, it's very, very similar. And the technique is similar, and just like with filler, some people still do it with a sharp needle, some people do it only with a cannula. And the advantages are the same. Cannula, especially around the eyes, less bruising. So the threads, there's really a crossover between filler knowledge and PDO knowledge. Within the sharp needle section, and when you look at the price sheet, you will see sharp cannula. That's how they're broken down. Within the sharp needle, you got unibarb and bibarbed. Unibarb is just that. The barbs, the hooks are all in one direction. So when you put the needle in, you pull it out, they lift. You manually pop them into the tissue, you've got a lift. The bibarb, 3 and 4D barbs just have barbs all around them. So you've got the barbs circumferentially rather than just on either side. Then you have bidirectional barbs, where the barbs are in one direction and the other, the lower half, and in the top half, they go in the opposite direction. So obviously the lower half is for lift, because the hooks are pointed cephalad, so they're going to lift the tissue and hold it. The top barbs are for anchoring, because what happens with age, we start to sag again. So if the thread starts to slip, the unibarb, it can slip. With the bibarb, those hooks in the opposite direction are going to prevent it from slipping. So you're going to get better anchoring of the tissue. And the massaging of those threads, we're going to go over today. Was important enough for capital letters. The barbs come in different needle tips, and you don't really need to know about this, but I want you to be aware of it so it makes sense. The FC is like a cannula, like you put filler in. It's a blunt cannula. 90% of your work, you're going to be fine with it. The FC45, forget, they don't make anymore. The FCL, rather than a blunt end, it's an L-shaped end. So it's got a little bit more of a nose on it that penetrate the tissue a little easier. FCN is like a bullet tip. That's the easiest to pass through tissue, but if I'm not mistaken, it's a more expensive thread. So for most intents and purposes, I've used all of them. I haven't had a circumstance where I absolutely needed an FCN. For most purposes, I'll go with the less expensive FC and FCL, and but I want you to understand that's why there are different types. You do have your choice. If you're dealing with your demographic population is very thick-skinned, heavy jowls, that sort of, you may have to use the FCN. You may find that, I'm really struggling with a blunt cannula. I'm really struggling, and I want to be able to slip this thing with greater ease. Hopefully we'll get a chance to work with the 3 different threads today. I know we'll be working with FC and FCL. I don't know whether he has FCNs, but just to be aware of that's the designation and that's what they're for. The sharp also, you have a risk of premature exit through the skin, which means you're putting it in here and suddenly it pops out. And with these threads, because the thread comes out the front, you can't back out. If you start and you get in an inch and you go, oops, wrong direction, you pull the thread out, the thread will come right out of your thread and you've wasted it. It comes out of the needle. So you can only back out to redirect about 2 millimeters. So with the sharp, if you go in and you pierce the skin and you come out the other way, and a cannula will tent the skin, you'll realize you're too superficial. With a sharp needle, you may not realize it until the needle's poking out, and then you got to start all over again. So it's another disadvantage. But that being said, do I use sharps? Absolutely. But I didn't use them until I was comfortable enough putting, especially in the face, where I felt comfortable that I was in the proper plane and I didn't risk any injury. Now, we worry about things. If you remember your anatomy, the arteries and the nerves run right along the bone. We should not even be down there. Once you hit the SMAS, which is where Ulthera and RF work, once you hit SMAS, patients say, ouch. That's how you know you're too deep. And you back up a little bit. So you'd have to go all the way. You'd have to be pretty determined to hit a nerve or an artery, but people worry about it, and I understand, especially around the temporal region. We understand that. The salivary duct is buried in the mid-buccal fat pad, so we shouldn't be even down in that plane, but people with thick skin, people with fibrous bands, these needles are not rigid. So if you hit something, the needle tip can bend and it can go deep. So I didn't use them until I was really comfortable that I was in the right plane with, and hopefully by the end of today, everybody will be comfortable that they're in the right plane. And cannula advantages, safety, you won't sever a nerve. The worst you can happen is a transient neuropraxia, which always gets better in a week or 2. The bottom line, okay, there's less bruising, the same cost as a sharp. There's no cost advantage for not having the cannula. Disadvantage, greater technical skill. The bottom line for we as physicians, people who work in offices, this is an extremely safe procedure because there's no lasting change, which means no matter, given the worst outcome, by the time the lawyer's letter gets to your office, the thread is gone. There's no lasting damage. That's what in the bottom, anytime I take a new invasive technique, that's what I'm worried about. I'm worried about legal ramifications. There's never going to be any lasting damage with this. You may have a pissed off patient. You may have to deal with working with them, but there is no lasting harm to the patient. If there's an asymmetry, if there's a dimpling, let's face it, we're new at this. This is hands-on. In the beginning, it's like any other procedure. Our first couple of patients, God bless them. And as we get better, not only do we get better, but our outcomes get better. So even though you look and you go, God, I can't believe I did that to this person, in 4 to 6 months, it's going to be completely gone. It's just going to be a memory. So I know it's uncomfortable for us in our hearts because we're in healthcare, because we care about people, but we have to take a deep breath and go, okay, it's not permanent. It's like Botox, it's like filler, it's going to be gone ultimately. Which brings us to vector analysis. Remember from our physics that a vector is a quantity possessing both magnitude and direction. Well, that's just what we're doing. We're lifting. Magnitude is the length of the thread. An arrow indicates direction. Length is proportional to the magnitude. So the longer the thread, the more lift. The shorter the thread, you're going to get lift, but it's going to be proportionally less. The resultant is the resultant of, so if you're putting in 3 vectors, the resultant is that net summation of the lift. So when I put 3 in, that's the face. Now those 2 outside threads are doing most of the heavy lifting. Those are the tent poles. I can put in a thinner thread in the middle without losing structural. Originally I was putting in all 3, and in men you're going to be using 19 gauge on the face, and for some heavy women. 19 is not as much as you think. But I may not want to put a 19 gauge because the thicker the thread, so people ask, how long is this going to last? It depends. The more threads you put in, the longer it lasts because of the denser network. The thicker the thread, the longer it lasts. It takes the body longer to hydrolyze and break down an 18 gauge thread than it does a 21 or a 25. Sample schematics, we're going to go over the trivector I just talked about. The resultant lift, you can use different thread lengths, you can use different thread gauges. Z pattern, mostly for the jowl lift and the submandibular neck lift, and parallel. Dr. Kim, who taught the Miracule case, all he treats is Asians. Asians have a different desire for a different outcome than Americans. And I'm not even talking about Americans of different races. I'm talking American. An American concept of beauty is high cheekbones and kind of a V shape. In Asia, it's more of an oval shape without prominence of the cheekbones at all. So he doesn't want to use the trivector. He doesn't want to undercut he doesn't want to exaggerate the cheekbones. That's what we want. Most of our clients want. And you ask them, they say, "Oh, I want more cheekbones." That's what the basis of filler is. That's where we put it. So when you're treating Asians, they may prefer a parallel rather than he was using most of his threads 3 different portals, which means you're poking them 3 different times to put a single thread in to do a more of a gentle, what I call a shower curtain lift, rather than the Z pattern. Yeah, that's the trivector. And again, we'll go over the landmarks. Essentially, when you do this, you're bisecting the nasolabial fold, you're bisecting the marionette line, and you're catching just the, when you look at the jowl, you can grab the fat, and it's about 1 inch. You want to hook the early part of the distal third, because if you just grab the tail end, it's going to pooch still. You want to grab it and lift up, but we'll go over that in the hands-on. But that's what when I talk about a trivector, that's what I'm talking about. This is the Z, where they do the trivector, although typically it's the smile line, not 3. This is a jowl lift, where you can adjust, you can put all your 3 to lift the jowl. There are people who don't have bad smile lines. They really just are a lower third lift. Well, you can still use your same 3 threads, but they can now do the heavy lifting on the jowl, and you can also put in parallel threads. The Z is the one along the jawline, and another one under the jawline, sweeping back to the mastoid, and you're just creating a visible jawline. This is actually the stair step. The stair step is another way of doing the parallel, but rather than putting them completely parallel, you're stepping them up. You're adjusting it to the contour. And again, your indicators, your finger test, what looks best. We had cases last training we did here with knees, where one knee we were able to do trivector and the other knee wouldn't lift. We had to do parallel. So it's all the finger test. The neck, again, a combination of either a bi or a trivector sweeping from the midline. For the turkey neck under here, works really well with a shorter, a 60 millimeter barb. Now, let's talk about the bi-barb. The bi-barb, how you massage it will determine your outcome. So if you put a bi-barb, if all you want is lift, say you put a bi-barb, 60 millimeter bi-barb in the face, and you just want lift, you massage from the distal end toward the portal, and you get lift. If I want smoothness, if I want to smooth out the jawline, say, put it in, don't massage, anchor, pull the needle out, and then you go to the midline and you massage away, and it spreads the tissue. If you want to add volume, say you want to give a man a little bit more prone cheek, you put it in, you massage from the outsides toward the middle. So the thread mounds up. That's how you engage your barb. So your outcome will determine how you do it. It's all in the massage. But a good technique for the neck, once you've swept it away, is to take a 60 millimeter barb, a single one under here, take the needle out and massage from the middle towards the end, and it lifts this tissue up. Does a beautiful job on it. Getting started. Who are the best candidates? This is what's going to come: mid-face ptosis, prominent nasolabial folds, marionette lines, jowls. The upper face, you can do a hooded brow, you can do crow's feet, you can do screws into the hollow. Tell people just avoid the areas that make you nervous until you feel comfortable. And we have alternatives. You use Botox in the forehead and then the glabellar lines. You can use filler under the eyes. And when you get comfortable, then we can start moving into using threads in those areas. Let's stay where we're comfortable. Mid-face, lower third neck, where there's very little that can go wrong with a cannula. Lips are another really, that these do an excellent. The only disadvantage of that, to do it comfortably, you really should be doing a dental block and the glabellar lines. You could do, now again, we make a difference when we look at a face between static rhytids and dynamic rhytids. When you look at somebody's face and you see wrinkles, and when they're in neutral face, those are static rhytids. Those are furrows. These are the 11s that even when someone's not frowning, they come into the office and people tell me I look worried. People who look smooth and they come in for Botox and they say, I want Botox, and you look at me and go, for what? And then they frown and then you see the line. When the wrinkles come out, only when they emote, those are dynamic rhytids. And I document in my chart what I'm doing, whether it's static rhytids or dynamic, because you treat them differently. I'm not going to spend a lot of time putting smooth threads in for dynamic rhytids. I'm going to use Botox for it because it's only going to be noticeable when the person, frowns or looks up. So, but dynamic, static rhytids that are there regardless, those are the things that make people look angry. It's like somebody with a knitted brow. People say I always look angry, and I'm not. I'm a happy guy. These are people you can hang. We make emotional. It comes back to we make emotional responses to people's facial features, and sometimes it has psychological effects that we can help with. Neck, the double chin. Caution. Feel it. PDO threads work on redundant skin. They don't work well on fat. If you pinch it and it's fat, Cannula, deoxycholate first. Then bring them back in 6 weeks, just like liposuction, just like deoxycholate in the back. When the skin is hanging because the fat is gone, or when someone's lost a lot of weight and now the skin is hanging, that's when you pull out the threads. The threads will work well on that. Do not do Cannula in the same session. You'll end up with a massive inflammatory reaction that's very unpleasant. People who have the vertical bands, feel them. If they're platysmal bands, if they're muscle bands, threads are not strong enough for those. That's Botox. That's a neuromodulator. If they're cutaneous bands, if they're just skin, that's what we use threads on. So just be careful. The horizontal static rhytids, I think there may be a slide in there. People who have these horizontal lines that when you pull on them, they don't lift. There's no lift. It's like a forehead wrinkle around their neck. Well, there's different ways. We can put in a meshwork of monos, or you can take your screw threads and put them in what's called stacking, where you put one and then you just stack them along right into the wrinkle, the way we do filler. And when it breaks down, it's going to fill in those horizontal wrinkles. So there are things we can do for them, because I don't really want to be putting filler. I get comfortable with a needle and going in the neck, especially you've got to make multiple sticks. Now this is before and this is immediately after. This is a woman that what she didn't like her smile line. She didn't like this right down here. This is what people don't like. This is where we end up adding a lot of filler to try to lift the corner of the mouth. But you add volume down there and it doesn't do anything about this. So I put a thread in here, I put a thread here, and I put a thread there. That's a tri-lift, and that's all I did. I put 3 threads on each side. Now, I didn't see her back because she was part of a clinic I was doing a training on, but you tell her in 4 to 6 weeks it's going to be even better. And because we've set up the vector system, they're going to retract, the skin is going to tighten and retract back towards the origin, so it's even going to tighten that. And again, it's your own body. People say, well, what happens when they wear off? You never go back to origin. You never go back to square one, because the threads are acting like a scaffold. A temporary lifting. It's like putting a construction building up and they got the temporary scaffold to hold everything up while it's drying. Your body's putting all the collagen, all the elastin, it's hooking onto that thread, around the thread, and when the thread dissolves, what you have is your own body holding that lift. So there's a cumulative, this is where I try to educate people that if we do this with mono threads in your first year, every 4 to 6 weeks we're going to lay in some and build the collagen base. We're going to do the barb. If we do that in the first year, then you're not going to have to do this regularly. Now you can come back maybe once a year for a tune-up, because we've regenerated the collagen. We've restored the collagen base in your skin. So now it's like you can move onward. Yeah. And this is just, there's no monos. This is purely barbs. Because the monos, it would be hard to show the effect because there is no instantaneous effect.
It's the same day.
This is before and immediately after. This is how she left the office. So you're getting results that you really can't get with anything else. And now, let it set, now you can bring them back and start paying some attention to this stuff with the laser and with your other modality, with your microneedling, with your other tools. But you've just given them such an impetus to, it's funny, when I first started getting into aesthetics, the first thing I did was vampire facials, PRP, microneedling facials. And when you do regenerative work, I got women that had, older women, 50s, late 50s, 60s, who had never had anything. No, complete aesthetic virgins. Never had Botox, never had, you do them, but they came for PRP because it's natural. It's my own blood, it's natural. 4 weeks later, they come in, they look in the mirror, it's like the gates of hell have unleashed. Now I want Botox, now I want fillers, now I want PDO lift, now I want everything. So people, you give someone that immediate effect, it lifts their spirits and it makes them very enthusiastic about, wow, if you can do this, doc, tell me what other options there are. And we're in the business of putting packages together for people. That's what I want to cover. You raised a really great question. Now, if I'm going to put threads in, how long do I have to wait? If I want to do RF, should I do the RF first and then do the thread? Well, these are the things we're going to cover. I'll give you the outline of how long it's generally recommended to wait between these things, and then you can put your packages together based on that. Areas of caution, major vessels, the temporal artery, it's superficial, you can feel a pulse. Supraorbital, supratrochlear vessels, when you do this is one of the areas that when you do a brow lift, which is a kind of a bivector, use only a cannula. You really run a risk of damaging vessels with a sharp needle. Facial artery runs deep along the bone. It's more of a psychological hurdle than it is an actual hurdle for us. Majoral nerves, temporal branch of the facial nerve, very superficial. They're trigeminal nerve points. You remember where the foramen are. As you get close to those with needles, it gets, it causes some discomfort. The marginal mandibular nerve at the corner of the mouth. Salivary duct we talked about. Anesthesia with monos. You can use topical. I think it's more of a psychological thing because it's good for microneedling, but once you poke the skin with a needle, the topical, BLT really doesn't do much, in my experience. But a lot of people like the feeling of having their face numb before they go through this. So feel free to use it. It's optional. That's why I put it. Barbs, we use local, 1 to 2% Lido with epi. The epi acts as a vasoconstrictor, which you need in the face. The face can be really vascular. There are different ways, we'll go over, of making this a more comfortable for our purposes today in the intro course. We're going to talk, if you're advancing the thread and you encounter a pain in the patient and you've repositioned and you just have to pass through the bands in this area right in here. This is where people have pain. They have no pain until you get down to this area. The needles the hub of the needle is a Luer lock. So you can put a syringe full of lidocaine, plain lidocaine. You don't have to use epinephrine down the barrel. Just put 2 to 3 drops ahead of where you're going, and now you're going through numb tissue. That's the simplest way. You can do it under tumescence, which means you use like a Dermasculpt 22 gauge, 2 3/4 inch cannula. You make your pilot hole and you inject, unlike filler, you don't reject retrograde. Here it's anesthesia. You inject anterograde a little bit. The problem when I don't do it on an intro course unless you're a really good injector, because if you use any more than 0.2 to 0.3 cc's for the entire length, you're going to end up with a visible line of fluid. And then you have to wait 30 to 60 minutes for that to go down because you don't want to put a thread with a fluid barrier between it and the skin. It's going to be squishy. You're not going to get good purchase. That was originally when they thought, wow, what a great thing. You put the thread in, squirt PRP down. What could be better? PRP, fluid barrier. You don't get good purchase of the barbs. So we're not going to go. You can also do the dental block, which we'll go over if we're going to do lips. You can do the zygomatic temporal for just the corner of the tail of the eyebrow if you're doing a brow lift. Field blocks you can do if you want when you're using large planes on the body. We don't really use them in the face. Topical anesthetics, and then let's talk about this, and then we'll take a break. You guys have been real patient. 5% lidocaine, misspelling, not a good choice for aesthetics. For aesthetics, you've got to leave it on about an hour, which totally screws up timing, and you need an occlusive. You got to put saran wrap over their face or whatever act you're rugging. It's better to invest a little bit, get BLT. These are 2 formulas. The second one is Charles Runnels' formula that, for vampire facial, he uses a different percentage. I was trained with the BLT. Most dermatologists use the benzocaine, lidocaine, tetracaine. I get it in 450 gram jars, and you just apply it with a tongue blade as a spatula. You can get it in smaller if you don't have that much need. Your compounding pharmacist can make it up. It's fairly stable. You can even buy it through many commercial compounding pharmacies like Central. Dental block we'll go over today. Transcutaneous block you can do if everybody's having pain when you come here. You just make your numb spot, go in with a cannula and inject a little bit of lidocaine right along this area, even in fanning motion. Now you've pre-numbed this area. So transcutaneous block is available to you. And let's take a break.